If you're pregnant or you're trying to be pregnant, this video is one you should never skip for any reason, because today I'll be talking about ectopic pregnancy, and this is one pregnancy condition that is rare but is potentially life-threatening, and it usually occurs in about 10 in 90 pregnant women. Many women don't even realize what is happening until it is too late, and that is why awareness needs to be spread. Okay, so in today's video you'll be knowing a lot about ectopic pregnancy. All right, hey guys, welcome back to my channel. My name is Precious and I'm a registered nurse. So normally when a sperm fertilizes an egg, the egg travels from the fallopian tube down to the uterus or the womb where it is implanted in. Okay, and it is in that womb that is a perfect place for a baby to actually grow in. Okay, but in ectopic pregnancy the reverse is the case. This egg, after being fertilized, instead of traveling down from the fallopian tube down to the uterus or the womb where it is supposed to be implanted, it ends up implanting in the fallopian tube or elsewhere that is not the womb. Sometimes it moves from the fallopian tube down to the cervix to implant there, or it moves into the abdomen, or it moves into the eggs, the ovaries, or it just moves into somewhere else that is not the uterus or the womb, which is the primary place where it is meant to implant. But in most cases the implantation occurs in the fallopian tube. It is also called tubal pregnancy. So it doesn't travel from the fallopian tube down to the uterus, it just stays in the fallopian tube and implants there and starts growing in the fallopian tube. And mind you, fallopian tube is a very small tube. Okay, it cannot expand just like the womb expands. So it's just like trying to force something into a tiny tube that is not elastic. So here's the key thing: an embryo or a pregnancy cannot survive outside the uterus. That is the key place where it is meant to survive in. Okay, so when this baby that is supposed to be implanted in the uterus ends up in the fallopian tube, it will stretch that fallopian tube as the baby is growing. Okay, and because the fallopian tube does not stretch like the womb, eventually it gets ruptured. It is so life-threatening that it can even take the life of a pregnant woman. So an urgent medical attention is needed immediately once this happens. Okay, so ectopic pregnancy actually starts like a normal pregnancy. Yeah, you miss your period, you get dizzy, you become nauseous, you become fatigued, just the same way a normal pregnancy comes with its symptoms. And that is why it is tricky at first. But as the pregnancy progresses, the symptoms, the weird symptoms that comes with ectopic pregnancy start becoming very, very clear. And what are these symptoms? They are the early warning signs of ectopic pregnancies. Okay, so number one sign is an abnormal vaginal bleeding. It's different from a period flow. Okay, sometimes this blood comes in spots and it's usually dark red in color or dark brownish in color, and this blood sometimes comes intermittently or it just keeps flowing. Okay, so it's one sign to note that this can be an ectopic pregnancy. Another sign is one-sided pain or one-sided abdominal or pelvic pain. Okay, so this pain is usually on one side of your abdomen. It's a stabbing pain. Actually, it's very, very painful, and this pain might come and go, and most times you feel this pain when you're coughing, when you're sneezing, or even when you're pooing. Okay, like in the toilet when you bend to poo or urinate, you just feel the pain more intense. So that is when you feel most of this one-sided abdominal or pelvic pain. Another sign to look out for is a shoulder tip pain. You start feeling this pain on the tip of your shoulder. It's a very serious, unique sign of ectopic pregnancy, and it is even more intense when you're lying down. You don't have to joke around with these signs, okay, because probably the fallopian tube has ruptured and you're bleeding inside. That's an internal bleeding, and it starts irritating some part of your body that will cause that serious pain that you're feeling on your shoulder, especially the diaphragm. Okay, so if you notice this sign, you need to see your healthcare immediately. I mean, you visit your gynae or your doctor as soon as possible. Okay, dizziness, weakness, or fainting signs, okay, is something to also look out for. This is because probably you're also bleeding already inside there. There's already a rupture and you're losing blood, and because you're losing blood, you tend to get very, very dizzy and fainty. At that point you start noticing a low blood pressure. because the level of your blood is low. You've been losing some blood internally. All right, some other signs are cold clampy skin based on you're losing blood, or diarrhea, or even bloating. Okay, some gastrointestinal changes. All right, so if you're noticing any of these signs, it's a serious sign of ectopic pregnancy, and you shouldn't take it for granted. Don't overlook, because an untreated ectopic pregnancy or even a ruptured fallopian tube causing you to bleed can cause you to lose your life, or can even reduce your level of fertility. Okay, so do not take these signs for granted. So what can actually cause ectopic pregnancy? In most cases, it's just due to a blockage or a damage in the fallopian tube, which is preventing the fertilized egg from moving down to the uterus. So instead of this egg to find its way from the fallopian tube down to the uterus, it will hang there in the fallopian tube because there's already a blockage that is preventing this fertilized egg from moving down to the uterus. So that is one major cause of ectopic pregnancy, especially when it's in the fallopian tube. But still, apart from a blockage in the fallopian tube, there are still some risk factors that can cause a woman to experience ectopic pregnancy. Number one is a woman that has pelvic inflammatory disease. Okay, that's PID, and this is usually caused by a multiple untreated STIs. Okay, so if you've had a lot of or some sexual transmitted infection that has not been treated, or that has been constantly treated in and out, you're treating a particular sexually transmitted infection, or you're constantly getting infected in and out, this is a risk factor for a woman to experience ectopic pregnancy. Number two is if a woman has experienced ectopic pregnancies before, maybe once, twice, thrice, there's still possible chances of her experiencing it over and over again. Okay, so if you've had ectopic pregnancy before, the chances or the likelihood of experiencing it again is very, very high. Okay, tubal surgery is another risk factor for a woman to develop ectopic pregnancies. Maybe something has happened before, and you've undergone some investigations down your fallopian tubes before, and constantly going there or having an experiment done there or invasive procedures done there can cause scarring in the fallopian tube, which can cause blockage too, and then leading to ectopic pregnancy. Endometriosis too is another reason why a woman might have ectopic pregnancy, based on maybe excessive tissue growth outside the uterus. Okay, another one is smoking, alcohol intake, taking of hard drugs. These things can lead to ectopic pregnancies because one way or the other there's an impairment in your reproductive organs, and that is why you should watch out for the causes and some risk factors that can cause ectopic pregnancy. But there's something I still need you to know. Sometimes a woman can still develop ectopic pregnancy even without the risk factors and the main cause of ectopic pregnancy. Okay, so every woman should watch out. Okay, be alert and be aware. All right, how will I know if I have ectopic pregnancy? I can't see my uterus, I can't see my fallopian tubes, you understand? And I'm confused. How will I know if I have ectopic pregnancy? So other than the signs, if a doctor actually suspects a woman to have ectopic pregnancy, probably also have displayed some signs and symptoms that a doctor might have seen or you've reported, there are ways by which your doctors can actually tell if you have ectopic pregnancy. Number one is through pregnancy test. If your egg that is fertilized attaches itself in the womb and starts growing there, as the days goes by, HCG, that's human chorionic gonadotropin hormone, which is a hormone that tells your test strip, okay, that you're pregnant. So if this HCG is not increasing, it's already a typical sign that you might be having ectopic pregnancy, because it increases every 2 to 3 days. So imagine your doctor testing for the level of HCG and he's saying that it's low. If it's in your uterus, it should be higher than this. So it's a sign that probably this egg has implanted in your fallopian tube or outside your uterus. Okay, so once they test and this HCG is still very low, is a very key sign that this pregnancy is not in the right place. Transvaginal ultrasound, this is done usually with a probe that moves into your vagina, and this probe can see inside your reproductive tract. Okay, you can see your egg, you can see your fallopian tube, you can see your womb. Okay, so once this probe is inserted into your vagina with a gel, a doctor can look through to see if the egg is actually implanted in your uterus. Okay, and you can also see if it is in your fallopian tube or somewhere else other than your womb. Another one is doctor can conduct a pelvic scan or a blood test to see if you're bleeding internally, okay? And once you're bleeding internally, it shows that it's an ectopic pregnancy that's even ruptured. So all these are diagnostic tests or procedures that your doctor can use to tell if you're actually having your pregnancy in the right place, which is the uterus, or you're having an ectopic pregnancy. Don't forget, early detection can save your life and also can increase or help your fertility, okay? Once an ectopic pregnancy is detected by your doctor, there are treatment plans that can go on, okay? The treatment is dependent on how early it is found, okay? So if it is noticed early or it is detected early, the treatment plan is different from if it is detected late. So there are three main approaches that your doctor can use. Number one is medication approach, okay? So a certain medication is used in order to prevent the baby that is growing probably in your fallopian tube or elsewhere, but most times it is a fallopian tube that most women experience ectopic pregnancy. So if this ectopic pregnancy is noticed on time, that's early, your doctor might give you an injection called methotrexate, okay? This medication is an injection. When it's injected into your body, it actually stops that baby or that embryo that is growing or forming in your fallopian tube. It stops it from growing further. If it's like this, it will stop growing, to remain like this. And not just stopping it from growing, this medication will allow your body, that's you as a mother of the baby, it will allow your body to absorb that baby's tissue back into your body. Your body will just absorb that growing baby naturally, okay? It will dissolve into your body, and this procedure will actually prevent your fallopian tube from being tampered, okay? You won't lose your fallopian tube with this procedure. Everything will still be intact, all right? And it will also help increase your fertility chances, all right? But that is if it is detected early enough, okay? But if this embryo or the baby is already grown too big, okay, it has grown to a certain size, which that medication can no longer work, there's a procedure called laparoscopic surgery, okay? It is usually done under general anesthesia. This means you go to sleep, okay? You'll be taken into the theater and you'll be put to sleep, and your tubes, that's your fallopian tube, will be opened, and that baby or embryo that is growing there will be removed. And probably, if it's not that bad, your fallopian tube can be sutured back, okay? It will be sutured back. Or if it's that bad, that particular fallopian tube that is affected, the doctor will cut it off, okay? So you probably will be left with one fallopian tube, but at least your life is saved. So, but that is what happens in laparoscopic surgery, all right? And the third procedure that can also be done is emergency surgery, okay? In this case, the tube is already ruptured, okay? Probably you've been feeling the pain and everything, all the signs and symptoms, but probably you overlooked them. At that point, the tube is already too stretched that it has to burst open. And once it bursts open, you start bleeding and everything. So an emergency surgery will be conducted immediately to prevent you from moving into shock or even losing your life. Some procedures will be done to stop you from bleeding because it's very serious. It's a very serious condition actually. So these are actually the approaches that can be done for a woman that already has ectopic pregnancy, all right? So recovery from an ectopic pregnancy is not just a physical thing, no, it's an emotional thing too. And sometimes some women grieve so long. Take your time, okay? Relax and take your time to heal. And some doctors actually advise that you wait till maybe at least 2 to 3 months, 6 months before you think of trying again, especially if you went through a very, very stressful surgery. You know, maybe part of the fallopian tube was cut off and a lot went down, okay? So take your time to heal properly. Don't rush to get pregnant again, and who knows, everything might still fall into perfect places and you get pregnant. Even though sometimes the loss of a fallopian tube can actually limit your chances of getting pregnant, that's the impairment of your fertility, but it doesn't still stop me from getting pregnant, all right? So even with one tube, you can also still get pregnant. So if you're going through this condition now, like you lost a baby or you had an ectopic pregnancy, this is me telling you that it is well, okay? And you come over it. You can talk to a friend, a counselor, your doctor. Just talk to anybody. Just know that you're not alone in this, all right? That you've had an ectopic pregnancy does not stop you from getting a healthy pregnancy that will embed in your uterus soonest. All right, and then you have a healthy baby. Thank you so much for watching today's video. If you've been in this condition before, please drop your comments and also share this video out there to a lot of women out there so that they can also know the signs and symptoms that comes with ectopic pregnancies in order to balance their chances in life, okay, and prevent losing a fallopian tube or prevent leading to their loss of life. Okay, thank you so much for watching today's video and see you in my next one. Bye.